short break and we're continuing and we've moved on to, can you recenter us what page we're on?
Yes. We are on page 28 of 30.
Okay.
Now we're into the reports. And so the way these are currently structured is there's a one-time report from AHS and a one-time report from the Green Mountain Care Board, both at different times than their regular, their annual, well, in one case, annual report. That's the board already has an annual report requirement. The other one is at a different time than the newly created AHS annual report on some of this stuff. So there's a bit of overlap that we could probably finesse to make one.
Okay.
Section 13 is the one-time AHS report. It has them reporting by November 15th with an update to the Health Reform Oversight Committee regarding the agency's implementation of this act, including the status of its efforts to develop the statewide healthcare delivery plan, advance healthcare data integration, and explore opportunities to retain accountable care organization capabilities, as well as on its Act 167 transformation activities, and the effects of these efforts and activities on Vermonters and on Vermont's healthcare system. So clearly some changes need to happen to reflect some of the work some of the changes you've already done. And you have monthly reporting on transformation activities. You probably don't need to have this report on transformation activities as well.
And the advanced healthcare data integration, we now just have them back January 14th.
We could really just get rid of that.
Get rid of that.
Preview.
Should we help them in alignment so that do we have anything in Representative Houghton's amendment coming in the fall of 2025?
You have monthly reports.
Besides monthly, there's not like I don't know, there were a couple I remember there was a July one.
Right, there's a July one and then monthly. In one case, monthly thereafter, in the other case, monthly, starting with the beginning of the hospital fiscal year, October. So if I take out those two pieces, what you have left is the status of its efforts to develop the statewide healthcare delivery plan and explore opportunities to retain ACO capabilities and the effects of these efforts and activities on Vermonters and on Vermont's healthcare system.
Okay, and can you remind me where we put the final statewide healthcare delivery plan?
Timing?
Because I know we sped that up.
Yeah, so timing, you have, the report comes in January 15th, or the first plan, January 15th, 2027. And then updates every 2 years thereafter. So you may still want an update on how that's coming.
Want an update on that? Okay.
I'm trying to think if there are other things you want updates on that we have changed in here. So data integration, no. And maybe it makes sense to looking at this to then skip for a moment over the Green Mountain Care Board one. So we're looking at the AHS ones together. So the other one, the ongoing report. So that's a November 15th report. And then this would have by February 15th annually, the Agency of Healthcare, Human Services would provide an update to this committee and Senate Health and Welfare. Basically the same language. Efforts to develop, in this case, develop and maintain the plan, and this, you may even want to say develop, maintain, and update or something, because you haven't been doing, you've moved the updates to every other year. Oh, this is where I have a note on quality improvement. You wanted something in here about, somebody wanted something in here about quality improvement. I think she handed the baton.
I think she did, and I forgot. Was that Leslie?
It was Leslie.
Well, I can put something in about measuring quality improvement.
Okay. All right.
Doesn't your amendment get to a lot of that?
Quality.
Yeah, it's fair, and it's fairly specific to the kind of transformation efforts. Mostly focused on hospitals.
Yeah.
Oh, Tupper has a.
Jen, correct me if I'm wrong, because I came in late. The date up there, the November date,
The November date. Oh, the first one? Yep.
November, yeah, that's gone, right?
No.
Okay, well,
It's
how
not
does
gone.
that, how does that compare with on or before January 15th, 2028? The agency shall present the plan to the House of Human Services and so on.
So this isn't the plan. This is just an implementation update on how implementing this whole act is going.
We're on page 28 now.
Yeah, I know that. I went back to that
Yeah.
date though.
So we've gotten rid of in here a lot of these things because we moved up the dates in the other areas.
Right, or just change things. So you're not having them report on advance.
This is an update.
Yeah.
I'm sorry.
Yeah.
Okay.
So, and I'm frankly torn on whether it makes sense to have separate reports just because of the different times. Maybe it does, and it's okay if there's some overlap, just because this is this one is a one-time report. There had been interest in hearing from, and again, maybe it matters less if you've moved some of the transformation reporting to monthly. As I recall, the Senate did not want to wait until next session to hear from the agency, but maybe if they're getting monthly reports between now and then, that'll be sufficient.
Yeah, and can you remind me when the ACO, isn't that by the end of the year?
Lines down, yes.
When it's done?
Yes, that may have been
Do
part of
we
the reason.
really need this? At all? I mean, or do we just need to combine what we want, the statewide healthcare delivery plan, into the February report?
I think you certainly could. I think you have, with the language we just looked at before the break, I think you have added in, significantly more indirect contact from and updates from the agency between adjournment and when you come back in January that may mitigate some of the concerns from the Senate.
Yeah.
Okay.
Happy Thanksgiving.
All right. So this is the best break. Section 13, the AHS report. And so on or before February 15th annually. Then they were in section 15, and then we'll look at the board ones together. The agency would provide an update on the status of its efforts to develop, update and maintain the statewide healthcare delivery plans. I'll add something about updating. Get rid of the advanced healthcare data integration. I don't know if you want the reference to coordinating hospital transformation efforts.
Well, we're still getting them monthly, right?
Still getting the monthly, at least, this coming February. We didn't really put an end on it.
Okay,
So at some point, it will be, probably next session or the session after. It may be appropriate for you to look at putting in an end date, but I'm not sure you know what that end date looks like yet.
and I think it's important to keep it monthly, so we really don't need them to come in to tell us that on this report, because we're already getting it.
Right, so you don't need the transformation efforts. All right, so now the question is, do you want them to be coming in or providing you an annual update on the status of their efforts to develop and maintain the plan? Do you just want them to come in this coming January until you have going? And then they bring you a plan the following January?
I definitely think they should be coming in next year to tell us how it's going, and we have that in the, we have that in that section.
Did we put them? No, they're just presenting you the plan. We didn't put it on update, which, it's statutory, so I think,
Just leave it. It's okay. Let's just leave it. We need a closet for you. I would like to align this with other. Diane, put it down.
I'm just gonna go away.
Good on you, mate.
I've forgotten where we are.
so I think the only thing that's left in this report right now, this annual report, is an update on the statewide healthcare delivery plan, and maybe that's fine.
Yeah, okay.
Um,
And to be honest with you, I like it in February instead of January 15th.
And so if we're just having the status of the efforts to develop, update, and maintain the statewide healthcare delivery plan, do you want something about, I know this has been important to a couple of senators on the last day, the effects of just those efforts and activities on Vermonters and on Vermont's healthcare system? Do we want to simplify that a little bit? Maybe we just say, and the effects of the plan on Vermonters in the healthcare system.
Healthcare authority. What does that even mean, really?
I think when it was more things, maybe it made more sense to be reporting on how all of that is affecting people, but I think there was some interest in perhaps paying attention to return on investment of effort and or resources. But I think perhaps if it's just the plan, it's just an update about the plan.
Yeah.
Okay. So not to complicate things, but I will. Do you want them to also tell you anything about the advisory committee? Want them to update you on the activities of the advisory committee when they're coming in,
Oh,
since they're chairing it? AHS is chairing it.
yeah. Yes. I would like that information. Activities.
Okay. And now I come back to the quality improvement. Do we
Yeah.
fit that in there somewhere?
Sorry, the quality improvement.
But-
Oh,
No.
lovely.
My margin notes is quality improvement. I don't remember that.
See if I have.
Well, you had said that it was important to some in the Senate, the effects of these efforts and activities on Vermonters and Vermont's healthcare system. What about, and the effects of these efforts on
You want
quality?
house quality and access?
Yes. I like access, cost, and quality,
That order.
or it doesn't have to be that order. but
Alphabetical.
3 things. Oh,
So I think Leslie was hoping for language that specified using that's just specify it was like professional quality improvement or another word to use.
We put in, okay, because I know we put, I have language in the beginnings of the markup draft to address what she was looking for in the way of the healthcare workforce.
The continuous quality improvement.
No, not
Something else.
not that part.
Okay.
The honoring or respecting the dignity, supports, develops and preserves the dignity of Vermont's healthcare workers. One of the goals at the beginning, not the same thing as you're talking about, just trying.
Accessibility, cost, quality.
You could reach out to Leslie, because I think she was much more.
Yeah.
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 Well, it could
You're
be,
going through her notes.
I am.
could be
Well, that's
anything.
actually good because she don't have.
Yeah.
Okay. I have a question there. So then going back here to the Green Mountain Care Board implementation report.
Before we get to the report of the Green Mountain Care Board, I think the Green Mountain Care Board would like to say something.
I wanted to tie a bow on things a little bit. So when you're talking particularly with counterpart in the Appropriations Committee, when you submitted the 6 positions, all right, the three were reference-based pricing focused, but the other 3 have titles, and I wanted to just read them to you because of the health systems finance principal analyst, health systems access principal analyst, health systems quality project manager. Those are the other 3, so that I wanted to make sure that it really did tie together, especially when you're talking about access and quality, that the positions that we're looking for that are in the government recommend.
Within,
Align with the name of the title of the job description?
And so, yay.
well, so we'll definitely have to put that language in the board reporting piece too.
Yeah, so as we track what's happening and whether they make changes to the bill, the budget.
Yeah.
It will impact, we'll have to have a conversation about which one of these 6
No.
go. And not go. Really, 2 of them are gone, the global piece is gone, but
Okay.
these 6 are still there, Jen.
Okay.
Okay, sorry. But you wanna know.
Oh, that's nice.
Okay, so we have again 2 reports. One is a one-time and the other is, it gets added to their annual report. So the one-time in the bill is section 14. That has by February 15th, the Green Mountain Care Board provide an update to your committee and Senate Health and Welfare regarding the board's implementation of this act, including the status of its efforts to establish methodologies for and begin implementation of reference-based pricing. Now you are not specifically asking them to develop global hospital budgets, but instead we talked about this is where they would report on feasibility and implementation timeline, definition of global hospital budgets, and the kind of pros and cons, which I'll put in.
Yeah.
So I think that replaces development of, but, and then the ongoing report is kind of the same thing with their annual, adding to their annual report that they would include the status of the board's efforts to establish methodologies and begin implementation of reference-based pricing. And maybe it just makes sense to take global hospital budgets out of here until, based on the February 2026 report, if that's something, because this one would be starting in 2027, just reporting, but until you know whether that's something you want them to take on.
Yes. Okay.
All right.
I'm taking out the whole thing.
No.
Oh,
Give me just a second. Okay, so what we're gonna do is keep the 2. At least on this one, keep the 2 reports. So we'll have a February 15th, 2026 report from the board on implementation of this act, including reference-based pricing and this kind of feasibility, timeline, definitions, et cetera, on global hospital budgets. And the effects of these efforts and activities on, I think we've been moving entirely to access cost and quality. I don't know if there's a specific way you want to have them talk about the new positions, although they may have either just hired or just still be hiring, depending on what the workforce situation looks like. So there may not be a ton to report in by February. Since they won't have the money for this until July.
At least their report can say we haven't been able to hire anyone yet.
Right. And then, in this
First lines of
ongoing,
your report.
the annual report that comes to you annually by January 15th, starting in 2027, they will be reporting on, and maybe we don't even want to say status of their efforts to establish methodologies for and begin implementation, but just their implementation of, the status of its implementation of reference-based pricing, and the effects on access, costs, and quality. Say it a little better than that, but, and that one starts in 2027 because you're going to get the earlier version in 2026.
Did we keep something in there about the global hospital budgets, like, and consideration of global hospital budgets? I mean, I know that we're telling them the first year to come back and tell us whether it's even feasible, but should we ask every year if they're considering it?
And any consideration of global hospital budgets if you want.
Yeah. Okay.
Yeah, and I've heard of just like that, we operate on the law that you pass and instruct us to do things. So I don't think we would consider telling you like, oh, this might be a good thing to do, or, but you would have to tell us to do it. We can consider,
Yeah, you can,
but we wouldn't do anything until.
No, but you'd report on any consideration of hospital global budget.
you can report on any consideration. Say we considered it and didn't take it under advisement.
Think it's premature, think we should move ahead, move forward with it.
Working well. That,
Yeah. Okay.
Yeah.
And that's it. And then we have the effective dates, and I think they would largely stay on passage, except that we would want that updated section 16 Fremont Care Board annual report to take effect in 2027.
right. Oh my gosh.
Sorry.
It's just-
So close. This is actually, so I don't think I was here when you all heard the testimony from AHS about the fiscal note. And so I'm looking at email that was sent that 4.5 million for section 8 to support and implement statewide plan development with hospital goals, designated as primary care organizations, blah, blah, blah. Which would consider service line analysis, operational analysis. So they provided a couple of points of what the 4.5 million is needed for section 8. Curious if we can get much more detail for that. It just seems rather broad. So is it for a consultant? Is it? I'm just curious if we can get for Tuesday, for our discussion on Tuesday, which I think potentially is the last day, if we can get some more information on the fiscal note. And maybe there's more and I just missed it.
Lori, would you mind giving the date of that email? Because we received 23rd,
Wednesday, the 23rd.
Wednesday, the 23rd.
Did we receive something?
Or is it posted on our website?
Yeah, that's what I'm looking at. Is it posted?
I don't know if it is. It only,
That was the day of the hearing.
And was that in the same email where they sent their language,
yes, I believe so.
which I think we did, we posted the.
But maybe not
language.
the language about the money.
Yeah. There was a memo. Yeah, and then they sent me a chart
Okay,
that here's how much it costs.
now it's,
Yeah.
embedded in,
And your fiscal note was updated based on that, right? Because your
yeah,
fiscal note
it
was from the
it was a
24th.
combination of that and then some other stuff that I gotten two different emails, people that were consistent, but each a little bit different language in each, so I sort of combined it, but also shortened it to make it clear on what, or for brevity on this fiscal note.
I think that's a great suggestion because frankly, you know, we have from the Green Mountain Care Board dollar amounts and positions and what those positions will be and what those people will be doing. But from AHS, we just have sort of a broad, this will support our work in blah, 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 blah. So in fact, there is one in there that says support global hospital budgets, which I don't know, can that get removed now? Because we've removed global hospital budgets. So we would really like by Monday, a breakdown of that, the 4.5 million spread over 2 years. What I'd really like to know what the money is being used for these individual items and not.
Elaborate, I would say it's all five, because if the 4.5 and then 250, 250.
Yeah,
But also the whole 5 million, is that still the number? And.
Yeah, more detail, not just a lump sum with a vision of what you think it will, but really down to each position that you think you're gonna require for this, or is it gonna be a contract? Yeah, we'd like a little bit more detail. Okay? So by Monday, that would be great. The last page, we are done. Daisy just asked me what page we were on. Like, I don't know the number, but it's the last one. Okay, so I feel like our legislative council has a Herculean task.
Absolutely.
And we still have some things to flesh out. I know that I do personally with legislative council. Was there anything else that anyone needed to, was taking ownership with?
I'm supposed to get Jen back in section 3, I think. Hold on. I'm combining sections 2 and 3 language around RBP to streamline and remove duplicates from 2. We can connect later,
Okay,
but that is on my task list.
Oh, Brian,
I think we'll be taking out the global hospital budget language again.
So if I have any suggestions, can I send something to Jen to look at and see if she can come up with a few sentences so it's a little more tangible?
yeah, and just to let you know, Brian, and I'm sorry if I didn't verbalize this out loud, I was intending to get with Jen on sort of our goals in the statewide plan, and you are absolutely seen, heard, acknowledged, and the high importance of looking at all parts of our system of care, and that includes the healthcare that we provide to our incarcerated Vermonters.
Thank you. And I think the way I would summarize it, because I think people get my point in general, is how can we realign the healthcare system so that we provide primary care as a public good to every person in every setting. That's, I think, how I would frame it. So, thank you.
Great, thank you.
I just wanted to put a footnote on Brian's comment about that, just so people are aware, there is a significant effort to look at that funding for healthcare for justice involved folks, not just the MAT, but there's a whole report that's been done that demonstrates how much it would actually cost if AHS delivered and managed the care themselves. And I can send the committee that report, or Brian can, but there is active efforts to look at changing the way that healthcare is delivered for those people. So Brian's idea, I really appreciate it. Brian, thank you.
Thank you.
I would just say that the Justice Oversight Committee.
That's
is-
right.
Since I'm on that.
I remember we had joint hearing last year.
Yeah, yeah.
We had a joint hearing with corrections and institutions.
And are we voting on this?
We need to have this voted out by Tuesday afternoon. So it is my hope that on Tuesday we will have a fully marked up version that we can walk through together and ensure that the changes that we've made are in alignment and that we will vote it out on Tuesday afternoon. Well, I will tell you, because the budget has now gone to a conference committee. Any bill that has money that is currently a placeholder in the budget has to be voted out by Tuesday afternoon. So we're on a deadline. Which
So-
is
So
why-
that means I will see you Tuesday then?
I
I'll be
mean,
glad to see you on Tuesday.
I will be glad to see all of you on Tuesday. All right, so we can go off of live.